it seems like we're heading into a storm of many simultaneous viral diseases happening at the same time. Obviously, COVID is still very much a thing and is actually in a new wave at the moment. But the other big story that is emerging right now is the fact that monkeypox has reemerged. And monkeypox, if you don't know, is cousins. It's related. It's in the same family as smallpox. They're both pox. So the main thing that would be recognizable about it is the lesions that appear on your body. It's all over your body, but especially probably the most cumbersome and painful have to deal with lesions that end up in your throat, in your mouth, in your anus. When people get monkeypox, it's extremely uncomfortable. Some people have died. But it's not a highly lethal disease. The reason why we're talking about it is because the U.S. is seeing a rise in monkeypox and has done very little to actually deal with it. And the fact that there has been such a limited response actually probably is exacerbating it into a situation where it's going to become more and more of a problem, whereas it could have been contained and resolved much earlier had we had a healthcare system in this country. But as we all know, and as you probably know, we don't have a healthcare system in this country. We have a couple agencies here and there at the federal level and at the state level that do not coordinate effectively at all. We have an army of private health insurance companies that are just looking to make a profit. We have hospitals, some of them private, some of them public, but overall, there's nothing that actually stitches this together. And so it's just one more example that, although it seems tragic right now, actually could become like so much more of like a massive issue just because we do not effectively respond to these things in time.
It's very disheartening to have basically just emerged. I mean, as you pointed out, COVID's not really over, but to have just emerged from several years of like hundreds of a million deaths, lockdowns, unemployment, and be confronted with the possibility of repeating that all over again. And something I was thinking about was, on the subject that you just brought up of, the fact that we don't have a functioning healthcare system and how much worse that makes a global pandemic is there was a study that came out earlier this year by some researchers, I think at Yale and at UMass Amherst, and they estimated that upwards of 200,000 lives could have been saved during COVID by a Medicare for All system. And I want to talk about that a little bit because, as people I'm sure remember, COVID treatment, vaccines, and testing is all free, or theoretically it was all supposed to be free. And I think that, at least in my experience, it did work out that way. I didn't pay for the vaccine. I didn't pay for any tests or treatment or anything like that. But these researchers point out that the reason why a Medicare for All system would have prevented hundreds of thousands of deaths is because it encourages early and preventative care, right? So the researchers point out that if we had a Medicare for All system, aka a healthcare system that isn't based on your employment situation, when lockdowns happened and a bunch of businesses closed and people subsequently lost their health insurance, again, even though COVID treatment was free, some people who had gotten sick might have delayed going to the doctor or seeking out primary care because they weren't sure if what they had was actually COVID, or they didn't want to be saddled with other bills and other charges, which did happen, by the way. Even though, of course, as I keep saying, everything related to COVID was supposed to be free, lots of people got stuck with additional bills or were wrongly charged or, had to settle up with their insurance or whatever in other ways. So there's that. Another thing is that a Medicare for All system, just if we had that in general, more people would have a relationship with a primary care physician, which is, something that I think, a quarter of people in America don't have a kind of longstanding or continuous relationship with a primary care physician. And these researchers point out that if more people had a relationship with a doctor, rates of vaccination would have been higher, right? So, you talk to your doctor, them, you trust them, and that would have encouraged greater rates of vaccination early on and across the board. And then the third piece is related to both of those things. Hospitals, as we well remember, were overwhelmed because of the kind of compounded issues of the prior two things that I talked about. So that's how these researchers kind of arrived at the number of like upwards of 200,000 lives could have been saved if we had just had a national healthcare system to begin with. And that's a little long-winded, and I have a little more to say about that. But Cale, any thoughts on how our broken healthcare system is probably not helping the developing monkeypox situation?
No, I mean it's not just not helping, it's probably primarily responsible for its spread right now. So like to your first point about preventative care, there isn't a single monkeypox vaccine. The vaccine that is being used right now to treat it it basically was implemented or was created in order to deal with smallpox. It deals with the entire pox family effectively. If you were born in the 60s or earlier, you probably are vaccinated, although you can look that up. I don't know for you watching if you have it or not, but if you're born after 1970 and onwards, there's a good chance that you aren't vaccinated, and so you probably should get vaccinated at some point. One of the things is that this is, I think, wrongly being treated as like a gay illness, a gay disease, like meaning that it affects gay people, people who have gay sex, and that it's been talked about as like a sexually transmitted disease when it really isn't at all. It's still a respiratory transmitted disease where it's particles in the air that go from one individual to another. So it's just close contact. And even though right now it has been primarily LGBTQ people who've been getting the disease, there's absolutely nothing stopping this from being contained to those individuals. In the US, I think there was like hundreds of thousands of the smallpox vaccine that we had but had expired and were no longer usable. We also have the New York Times was reporting on this, that there was something like over 300,000 doses available over in Denmark,
right?
That the U.S. has very slowly decided to bring back over, and that really the estimates right now are that the U.S. is not going to actually have adequate dosage available until like early 2023.
Yeah.
So
great.
yeah, great. So the fact that like we don't have preventative care, we don't actually have a healthcare system that says, well, actually, you know what, maybe diseases come back sometimes, and we should have vaccines and various preventative medical services and care like stored properly, ready to go in case these things come about, which is of course a cost, but like it's the alternative, as we've seen time and time again, is that when you don't put money into these things, and when we have a system that does put money into maximizing profits for private individuals and companies and investors, you end up having horrific social outcomes, health outcomes that completely could have been prevented if you actually just put human need and interest above profit.
I want to make just one last point on the other ill effects of the government sort of dragging its feet on dealing with what appears to be, another like burgeoning epidemic. And that's something that I just like constantly think about, is how slow the US was to respond to COVID when it first started developing. And that was perfect storm of obviously the Donald Trump administration, not Donald Trump's particular brand of ego and not wanting to, acknowledge a pandemic. There was that, but that wasn't the only thing. Obviously, the US, as we've been talking about, lacked just the healthcare infrastructure in general to sort of nip COVID in the bud early on. American-style federalism just meant that, every state and every city was basically not operating on the same level for better or for worse. So, the response was always staggered and uneven. And, just to go along with the healthcare stuff, like just a complete lack of a social safety net and like any kind of social support that could, deal with sudden and mass like work closures and unemployment and everything. And what basically happened is, as we all know, is because the US government basically signaled to the population that you're on your own, COVID, which it was and is a public health crisis, quickly turned into a culture war, right? From like
Mm,
all sides. And, Cale, you and I were talking earlier today about like why COVID a didn't lead to any kind of meaningful healthcare reform. And I think
right.
that a large part of it was that there was no coordinated response from the government, and it quickly devolved into a culture war. And I remember, I always have to mention Bernie Sanders, but in the early days, he was advocating for things like the government manufacturing and distributing masks to everybody,
Mhm.
free. He advocated that very early on. He wanted to, pay people to stay home. He tried. None of that happened, of course. And something I think about is whether any of that would have like helped stave off the culture war that developed, as I keep saying, from just all of us being in a vacuum and being told like it's on you to deal with this.
Right. I mean, even like for instance, if you compare and contrast the US response to, for instance, like the Chinese response,
Hmm.
the Chinese state's response. No, but like they actually like, I mean, it was like very forceful. It was
Yeah.
overwhelming in some cases. And like,
Hmm.
there's lots of issues, but like, and there's lots of issues with the Chinese government. I'm not talking. I don't want to get into the whole thing about
That's a
like the
different episode.
yeah, we're going to talk about China at some point, but not right now. But the point is just that like by like April of 2020, they
Hmm.
had effectively dealt with COVID in their country, that they had actually like capped and like actually
Hmm.
restrained the spread of the disease.
Hmm.
The fact that it has remained a massive global problem has to do, like you're saying, with the American states' complete and utter inability to actually contain this, like both
Hmm.
in the response, but just in the actual capabilities.
Hmm.
That like countries that actually have greater state capacity,
Hmm.
regardless of kind of political ideology, intention, how they're like actually operating, but actual greater state capacity has actually led to greater containment
Hmm.
of the disease. Whereas in the US, like we have effectively allowed it to become this persistent global problem.
Right.
And that is directly because of the power of the American capitalist class. The
Hmm.
fact
Hmm.
that the American capitalists have completely just destroyed like the actual infrastructure of the American state, has like made it incapable of taking care of these
Right.
like social
Right.
problems,
Right.
that they are directly responsible for the fact that like we still have to worry about this and monkeypox
Hmm.
and all these other possible viral diseases that down the line might be more contagious and more deadly than something
Right.
like monkeypox.
Since you brought up China, I want to bring up a different cross-national comparison, and that's the Nordic states. And I'm
Yeah.
specifically thinking about Sweden because I remember, when COVID started becoming a thing in 2020, like a lot of right-wingers got super interested in Sweden because Sweden wasn't doing any lockdowns. They're basically like, we're going to, or at least the Republican narrative was like, they're just like going about business as usual, and it's like not a big deal. And the citizens of Sweden can be trusted to take personal responsibility and decide for themselves like whether this is a big deal or not. And that was always very spurious because the thing is, it is true that Sweden. I mean, I can't like replay Sweden's like complete response to the coronavirus, but I do remember in the beginning, Sweden was not draconian with lockdowns. It really
Mhm.
did seem like people were going about their business, and it did seem like the citizens of Sweden were sort of taking personal responsibility and like figuring out what worked for them and their own families. And I just want to say, I'm sure everybody who's watching this show agrees or is already aware, but that's because there is a very high level of public trust in Sweden, and that's because they have a really strong welfare state and really strong, worker protections. And what I mean by that is people knew that if they were sick, they could stay home from work because they have a very generous paid and sick leave, program, right? Like they, of course, have a national healthcare system, so people could be trusted to kind of go to the doctor on their own when they felt like they were sick. Like it just goes back to what we were saying before about a healthcare infrastructure and a strong social safety net. Like that kind of thing isn't just good for people. It also creates the sort of like personal responsibility, if you want to call it that, personal
Right.
and social responsibility that like the US government was demanding from people without providing any of the supports to enable any of that.
Right. Yeah. The Swedes and the Norwegians,
Mhm.
what it was, get vaccinated and then get on with your life.
Yeah.
Like,
Right.
and because we
And
actually
and there's
have
and it
a
worked for
society.
them. Yeah, exactly. It worked for them because they have a society, not because, they're better people or there's something
Right.
about like the Nordic brain or attitude or whatever, but because like this basically like yeah, like the states enabled
Yeah.
that level of self-sufficiency. I don't know how else to say it.
Yeah, and then you contrast that to the US, where like there was another story that actually Jacobin ran recently by Matthew Cunningham Cook about how Amazon is purchasing One Medical, which is a primary healthcare provider, a private healthcare provider. Um, and that's what our system does. The
Yeah.
state doesn't actually do anything. And in like it's still just remarkable. I mean, like it's like insane to think about. It's still just remarkable that like the state, in spite of everything that we've been through the last few years, is not willing, or more likely cannot, because of the power of capital and business, actually take control over public health as an
Right.
issue. It remains something that they just say, whatever, let the market figure this out. Let
Yeah.
private capital deal with healthcare. And we have to, this is, I think, what the left has to be focused on. Like it's only going to become more of an issue. This has to be our focus. We have to go back to Medicare for all and prioritizing healthcare. Sorry.
I 100% agree. If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.